Welcome to the show, everyone. If you are finding this on YouTube, know we have a podcast. You can download it and take us with you. It's in the link below here on the video. If you're on the podcast, we did a video. I'm looking forward to introducing to you today Dr. Shah. He's a cardiologist, and we're going to talk about blood pressure and heart and everything that has to do with prevention and why this is a topic that you don't want to miss. And you're probably going to want to share it with a bunch of people that you know also, because so many people have unnecessary lifestyle-derived heart disease and conditions that can be more easily reversible than you probably think. So welcome to the show, Dr. J.
Thank you very much, JJ. It's a pleasure to be here.
So for those of you that are finding this because of either Dr. J or you have a heart issue and you don't know me because you're here on YouTube, I just want to let you know this is my show. So what that means is I'm going to talk. And if you don't like me, I am totally fine with that. Where can they find more of just you, Dr. J, if they don't like me?
Yeah, so I'm on LinkedIn. You can always look me up on the LinkedIn profile. You can look up all our channels on social media at Aktiia Global, and our website, of course, www.aktia.com, AKTIIA.com.
All those links will be in the show notes and under the video here on YouTube, if that is where you're finding us. So welcome to the show. Let's talk about, first of all, you are very young to be a cardiologist. I want to know your story because you seem like you're 20 and I'm like, you're a cardiologist. So let's go back and tell the audience a little bit about your story and how you got here and your passion for what you're doing.
Sure. I wish I was still 20, but at any rate. So no, I grew up in the Midwest. I grew up in St. Louis, and I grew up, sort of thinking and wanting to be a doctor, like a lot of doctors actually. And then from a young age, I ended up going to medical school at the University of Missouri in Kansas City, which was like a real city general hospital. It was a great place to be a medical student because they were chronically understaffed in many different areas. So you were given a lot of freedom and learning in the OR as you were an assistant in the operating room. In the ER, you were dealing with trauma with the attendings. It was a great place to be a resident medical student. And then I went to Massachusetts General Hospital in Boston as part of Harvard Medical School for my internal medicine training, which was a totally eye-opening, different direction. I was sitting there and my colleagues were people who had just come back from Africa after running an NGO for the WHO for 5 years. And then on my junior resident was someone who had invented a molecule and sold it to the government of Singapore. And this sort of really eye-opening way was able to see what all the possibilities, in medicine there truly are. And most of my colleagues from Massachusetts General Hospital have gone on to be leaders in all kinds of aspects of medicine. So that was a great learning. And then I did my cardiology training at Washington University in St. Louis, which is a 1,100 bed hospital in the middle of the country, which is deeply rich in its clinical training. So I really enjoyed learning about really how to be a great cardiologist there. But you never really learn how to be an independent doctor until your first 3 years in practice. And so after I did all this training, I went out to Portland, Oregon and started my own practice from scratch. It was just me and a medical assistant and 2 EKG machines. And that was it. And so for 7 years, built this very large, very busy practice. And that was the time where I really really truly understood and learned how to be a great physician and how to be embedded in a community and embedded within, I think community is the best word. I was sort of people's family doctor. They came to me, their sister, brother, mother, father, everyone sort of just came. And that was a really rich experience. And then my last leg of a clinical journey was at Mayo Clinic. I had these opportunities at Mayo Clinic that came up. And then I came down to the Mayo Clinic campus in Arizona, and we started a program for thoracic aortic diseases. So very, 90-degree turn, super complex, high specialty type of practice, which was also a great learning experience. So that was sort of my clinical journey. And then about 2 years ago, I started thinking, well, how can I now take all this sort of expertise that I've gained over the last decade or so plus in practice and come up with a different way to apply and have a broader impact. And so I started looking at many different things, and through exploration and learning, I actually happened to find this startup called Aktiia, which is a Swiss startup, and one thing led to another, and I came on as the chief medical officer now 18 months ago. And so that's what I'm doing, pretty much full time, which has been a total at 180 from clinical practice, but so managing and handling multiple aspects of business as it relates to, with my clinical experience and within a startup. So a highly dynamic environment. So yeah, that's been my professional journey.
Let's go back to why you chose cardiology.
Yeah, it was, I had thought about cardiology for a while, and I think the reasons it attracted me were two main things. One, it made physiologic sense. Like there was a lot of known, mechanisms in cardiology. So people had already worked out, scientists and leaders before had already worked out a lot of the mechanisms, the pathways, and developed treatments. And so that leads to the second part of the answer, which is you can do things when something happens and goes wrong in cardiology. There's a lot of fields where there aren't really good treatments, or there are sort of very minimal amounts of treatments. And there's a lot of I don't knows, and we don't know, but here, try this. In cardiology, there are lots of treatments for many, many different things. And that's really kind of what attracted me to that field. And combined with the fact that you could build and keep a relationship with patients over a long period of time, which was really important to me, to sort of really be in that partnership between a physician and a patient, and really get to know people, and for them to get to know me. So that's why I chose it.
What did you learn that you didn't think you were going to learn when you went into private practice and used the education with the people?
So I knew maybe I had all this clinical knowledge, but I knew maybe 50% of what I needed to know to actually build, start, run, and develop a practice. And it had to do with business aspects, like how to do cost analyses, how to negotiate equipment, how to do par levels, how to, really build a referral base, how do you build trust in a community, how do you do those things, and the hard work that it takes to do it really isn't taught in, medical training, and so that's only learned by doing. And so that's what I didn't know. And then there are so many times where you have the scientific and academic clinical knowledge, but it doesn't tell you what to do at that moment in time at 3 a.m. when somebody's calling you and they're having some emergency. There are many, many times where it doesn't fit into the boxes and the textbooks and the things that you've learned. And so in essence, we call that just judgment, clinical judgment. But that is the most difficult thing to learn. And that is only learned by really being a busy clinician for at least 3 to 5 years.
We were discussing before we started recording about prevention. And, from my point of view, with understanding, and I've had a lot of doctors on this show, mostly integrative, functional medicine, naturopathic, not a lot of allopathic doctors. And because my point of view is prevention, but I don't really think I don't find that in allopathic medicine. And so where would you find yourself in that? Like, what led you to having this conversation? I know you just said with the reason why you chose cardiology was because there was something you could do about it, but that's after the fact. Prevention has nothing to do with after the fact. It has to do with before you ever get there. So what led you to that sort of turn, or that adding that into your point of view?
Yeah. So I think it was just time and experience of seeing tens of thousands of patients, and I would treat them and we would be generally very successful. Someone would have an event, have a heart attack, need a surgery, have an arrhythmia, have some complication, and we would treat those complications. And almost universally, they would come back to me in the office after their surgery or after their procedure or after whatever treatment we had instituted. And they would come back to me and they would say, Dr. Shah, why did I have this? Like, why did this happen? And for cardiology, cardiovascular diseases specifically, the majority, not always, but the majority of the reasons as to why have to do with chronic diseases that have been going on for decades, usually, either undiagnosed, poorly treated, ignored, that have then led to some event happening. And we all kind of conceptually know this, but it's human nature generally to either ignore things you can't feel or things that are not apparent, and they're not causing you discomfort because there's an assumption that, I'll deal with that later. But in the case of cardiovascular diseases, for example, hypertension is the most common driver for the majority of cardiovascular disease. Well, high blood pressure or hypertension is silent, and you don't feel it, and it generally starts in your 20s, 30s, and 40s of life. And so I have these 65-year-old patients sitting in front of me saying, why did this happen? And the honest truth is, well, this started when you were 30 years old and you just didn't know, or you didn't feel it, or it wasn't, paid attention to. So it really, when I made this sort of pivot into the startup world, what attracted me about Aktiia in particular is that the entire focus and vision and mission of the company, and what I sort of bring to it, is that I want to change that process or that paradigm so that people are really start being much more aware of their chronic conditions long before they ask me that question in the office.
Yeah, that's good. That's good to think about, because there are so many people who just medicate and then think that that is enough. And like you said, you can't feel it, you can't see it. I mean, you might be able to feel it because you have, your heart's racing, and maybe things are hard. Life is harder on your body than it should be. Your heart is working more than it needs to be and isn't up to speed, if you will. I work with a lot of cancer patients and cancer doctors. And, one of the sort of grounding foundational understandings is that cancer didn't happen yesterday. It was, it's years and years and years in the making. And now it's here. So we're not looking at what did I eat yesterday or last year, or what did I have exposure to? It's when did this start, and looking at the entire terrain and different points of how we created an environment from which that happened. And so right now it sounds like we're looking at, and I know we're going to focus on high blood pressure right now because of Aktiia. But I also want to ask you what other chronic diseases would be leading to these heart attacks and heart conditions that people are ignoring.
Well, I kind of term them in as an umbrella, diseases of plenty. And this is just a sort of a cultural thing that has happened over the last 150 years with the Industrial Revolution, is that our lifestyles have generally all become, especially in developed countries, one of excess, right? So excess calories, obesity, diabetes, high blood pressure, sedentary lifestyles, lack of exercise. With the invention of automobiles and personal transportation, not many people walking, biking to work anymore and back. All these things that are considered advancements in technology and sort of and infrastructure have side effects, have corollaries, and a lot of that leads to these disorders, and that's why we're seeing that non-communicable diseases like cardiovascular disease are just growing so rampantly and so significantly throughout the developed world, and even in the less developed world. It's because of these sort of inventions and progress, so to speak. It has another side to it. And so obesity, diabetes, high blood pressure are the three most common, and smoking, although that has declined significantly, is still a significant driver.
I want to impart on people listening the word consequence. The word consequence so when we have like a technological advance, there's going to be a consequence. Okay. So GMOs, for instance, right? Technological advance to try to make more crops grow and be resistant to weather and pests and bugs. So we crossbreed with pesticides. Now we have a poison in our food. Consequence is now we have digestive issues, SIBO, SIFO, all the things that, allergies that kill a person by eating a food that 20 years ago didn't happen. Consequences to technology and the speed of information is anxiety, overwhelm, depression, right? And those are consequences of, here's this thing that allows us to do this thing, but what's the consequence of it? And it's not to make it bad. It's to recognize the lack of balance and then to do something about it. Correct. So I just wanted to make those connections because I think that was a really important piece of understanding. We're going to go back and look at high blood pressure and sort of how do we start to look at these clues that are in our lives now. And you mentioned it can be as early as when someone's 30. Someone who's 30 is not going to the doctor to see if they have blood pressure. So are there symptoms? Are there like, what are we recommending in terms of this? I mean, and you can go by either decade or, a person's age of when it's time to look at this. And then of course, what happens when they don't? And if it's just heart attack, is it, what is the result or consequence of ignoring it?
Yeah. So, and I'd like to add on to that point about a consequence. One of the most common ones that people talk about, because obesity and weight is such a pervasive problem, is about the food technology, the technologies that have been developed to enrich and process foods, so that our foods today are the highest calorie dense foods that have ever existed in the world, and that our bodies are really not made for that stuff, that type of, processed foods, right? We're genetically and historically made to sort of eat some meat like once a month when you kill like a woolly mammoth or something, and then mostly eat nuts and berries for the rest of the time. That's what our bodies are built for. And only in the last, century, we had this dramatic progress on food technology that has led to this other consequence, which is highly enriched, highly calorie dense foods. So to get to your question though, about blood pressure. So first of all, the answer is you don't feel it. 99% of the time, you do not feel high blood pressure. It causes no symptoms. It causes no pain. There is no discomfort. Routinely, people will be in the office and you'll say, okay, your blood pressure is 170 over 100, which is very high. And they have no idea. And so, and as you said, and I mentioned before, it does start earlier in life than people think it starts generally. The prevalence of high blood pressure is 1.4 billion people in the world. In the United States, it's 130 million people. And 1 in 2 adults over the age of 65 have it. So it's exceedingly common. It's the most common disease in the world, period.
Okay.
And so there are recommendations to start checking your blood pressure even as you turn into an adult, as age 18. But like you mentioned, most 18 to 40-year-olds don't go to physicians very often. They just don't. You feel good. You see a physician occasionally. You might have an urgent care visit here or there, but you're not generally going to physician on a routine basis. And so you're getting, generally, that's the time when people get blood pressure checks. And so sporadically, you might get some numbers, but never really consistent enough to probably even think about, is my blood pressure high, or is it just normal? Or what does that even mean? And how do I put that into context, which we can talk about that. But so that's why people generally don't know they even have blood pressure until they're much older. And in fact, if you look at, of all the people who have high blood pressure, a little less than half even are aware that they have the disease. So if you're not even aware of it, how can you make any impact, either yourself or with a partner as a physician or anybody?
I think because of my personal training background and I would take blood pressure. In fact, I have a cuff. I have one of the automatic units, right? But I have the stethoscope. I have the whole thing, and I used to take people's blood pressure. Yeah. And then because of, again, the training and weight loss and health and looking at resting heart rate. And always having a device of some kind, not right now, but I was using polar heart rate monitors from the time they probably came out until recently. I still have a watch, but it's not connected to a chest strap. So I've always sort of been looking at that. And it's actually how I had diagnosed after my wedding. I had come back. We were in Hawaii, and it was after our honeymoon, and I came back and I went for a walk or a run around the block, and my heart rate was so high. And I was like, what is going on? And I thought to myself, this has to be adrenal fatigue after the fact, because I had been in such a high state of stress for so long with the wedding. And then once the wedding was over, my body had not recovered yet, because I was literally not running. I was walking fast and I was in my target heart rate zone. I was like, something is off. And I had always recommended that people, especially during exercise, use some kind of device to monitor where you are, because you can't feel it. I've had a woman, I remember in the gym, this is so many years ago, and she'd come on and she was so routine about what she'd do. She'd bring her huge cup of coffee she'd be the first in line on a Saturday morning, get on her same treadmill, and she would just run. And she never varied from that routine. And one day she fainted and fell off. And I thought to myself, had she had a monitor on, had she been paying attention, because she was ignoring all the signs before she fainted and passed out and fell off the treadmill. So I thought if she had a monitor on, she would have noticed when she was off. She would have asked the question, but we get so in our routine and so focused and in a way that we ignore those signs. So I'm with you. I've seen that happen in the gym. And maybe because of my being in the gym and being in this field for so long, to me, I'm like, oh no, I always take people's heart rate when, just because I want to know. I don't take their blood pressure anymore because I'm not really actively personal training. But what are some of the devices that you would recommend? And can we talk about for a second the difference and the importance or the lack of importance or the correlation between blood pressure and resting heart rate? Because to me, how I used to explain like the heart muscle for both of the things, and correct me if I'm wrong, this is my way of oversimplifying to the average person why any of this is important. Okay. So just like your muscle, if you're weak, so the blood pumping in and out of the heart is a muscle, and the stronger the heart is, the more blood it can pump. The more clean the system is, the faster it can be, delivered to the rest of the body. And the diastolic number being the relaxation phase. And when your heart is strong, it doesn't have to pump as much. So high blood pressure, a weaker heart has to work a lot harder to get the same amount of blood to the rest of the body. So just like building muscle to be stronger in life, we want to build the heart muscle to be stronger, to be more efficient with moving blood to the body. Is that accurate?
Yeah. So I think in broad strokes, for someone who doesn't have like a significant other cardiac condition, that's generally correct. So if somebody is athletically trained, has conditioned their heart, is exercising, aerobically, routinely, generally the resting heart rates will be lower because the capacity of the heart to pump each beat and the volume of blood that is pumped out is higher in an athletically trained heart. And conversely, if someone is poorly athletically trained or has less aerobic capacity, the capacity of each heartbeat and the volume of blood pumped is smaller, and therefore to keep the same circulating volume of blood, the only way the heart compensates is by raising the heart rate. So that mechanism of heart rate and cardiac training does exist. There are some like different cases if someone has some like an arrhythmia or other conditions in the heart that's a separate issue. But in the sort of normal physiology, that's kind of how it works.
I was trying to oversimplify so that people would understand sort of why why they're monitoring it, why they're working on it, why they should care, right? Because as we age, and it doesn't matter from whenever you start any of this process, the stronger the body, the easier life is. And the less injury that you'll get if you have good muscular strength and good bone strength, you don't get injured as much. If you have good heart health, you don't have heart issues. I mean, it's pretty, this is normal. This is like logical. But again, we have to explain it. And I was in a gym and in gyms where people were coming and who cared. But when you talked about that 50% of the people who have high blood pressure don't even know, those are the people who aren't exercising. They're the ones not going to the gym. They're the ones who are not concerned about their health necessarily, or they're in reactivity versus proactivity, which is what most people do. They wait till something bad happens and then they go to try to fix it, versus recognizing that aging, and I always said this, aging is like when you start to kind of fall, your body stops beating gravity. Like when you let gravity win and you start to fold over, this is aging, and it gets harder in time, but you absolutely have all the tools to excel and to be optimal no matter what age you are, because you can proactive, like what you choose to do now affects where you're going to be in 5, 10, 20 years from now. So let's talk about this transition of you focusing on prevention and Aktiia and monitoring and the importance that you think it is and how we can do it.
Right. So the first thing I would say is that first of all, the understanding of blood pressure, I think even understanding like what that means and what the risk is, I think we should probably talk about that a little bit, because even to this day, everyone understands that high blood pressure is bad, like generally and conceptually, but it's not usually a clear line that people quite grasp, or they don't necessarily put as much importance on it as they should. So what often happens when I see someone in the office, and you probably saw this people when you're doing personal training, is you'll get let's say you take one reading and your blood pressure might be a little higher, let's say 150 over 80. And then so they say, well, I rushed in here. I ran in here. I drank 2 cups of coffee. There was a lot of traffic, doc. It's normal at home. It's normal at home. It's good. It's good. And then they check it at home sporadically. They might have a cough and they check it a couple times and they get a couple of decent readings, like 130 over 80. And they say, okay, I'm fine, because I got a couple good readings. So there's this concept of one blood pressure measurement at one time gives you a sense of your baseline or your stable blood pressure level. That is completely false. That concept exists because we have these things called blood pressure cuffs, which only take your measurement at one point in time. And then also exists because physicians and the medical system has sort of reinforced that, because that's been the tool that we've had for over 60 years to measure blood pressure. So one point in time, you're sitting in the office, you take a measurement, I'm going to write down that measurement, and that's your blood pressure, JJ. But truth is your blood pressure fluctuates every minute, every day, every hour, every week. It's fluctuating constantly. And so if you just take that one point in time reading, do you really understand the rest of the sort of pattern of your blood pressure and the overall levels, and what happens at night, and what happens during the morning, and what happens in the evening, and what happens when I'm stressed, and what happens when my kids are making me angry, or I'm in a stressful meeting? You don't know any of those things. So that's the sort of, part of the transformational difference between episodic point in time readings and what we're working on at Aktiia, which is a continuous type of blood pressure monitor that you just wear, and you're getting all these readings throughout days, weeks, and months. So you get a really accurate picture of what is your real blood pressure over time and what is your pattern.
So that reminded me of a situation with clients that had monitors, or I would monitor it and they'd say, oh, see, I'm good. And they were on meds.
Yes.
And I'm like, hold on. No, you're not good. You're on meds. This is not you. This is your meds. Yes. And so can we speak to that for a second? Because people will say, oh, I'll test but I'm on the meds. I'm on the meds. The meds are going to do it for me. I don't got to do anything different. The meds are going to control that for me. Can we talk to that?
So that is, and as a cardiologist and as a physician that does, dispense medications and prescribe medications, that is unfortunately part of sort of this, I think, cultural reliance and, the healthcare sort of system reliance on reactive treatments. We're going to treat this with medications. Okay, we have a new weight loss drug. So yes, you have obesity, take this medicine and it'll help you lose weight. Okay, it might help some people, but it's very reactive. And so blood pressure is another one. And so what that leads to is a psychological assumption that the meds or the procedure or the tool or some other treatment will take care of my problem when it occurs. And the most clear example of the cardiology is one of the most clear examples of this is that people tend to ignore doing the hard things, the proactive work, the exercise, the diet, the weight loss, et cetera. And if and when something happens, they say, well, yeah, but they can fix that. They can put a stent in, or they can have I can have bypass surgery, or I can do X, Y, and Z. And yes, we can, but is that really, is that really okay? Is that really what you want? And it's great that we become so good at those things because people need it, and that's good. But the consequence, like you said before, leads to a psychological reliance, an over-reliance on those treatments to fix things, which is in truth, none of them are fixes. They're Band-Aids, they're patchwork, and that's the interaction between human psychology and modern, medical healthcare.
Yeah, dependency and inability to want to take responsibility. And I don't say that lightly, because I think people need to be slapped in the face sometimes with the understanding that that when you rely on, because you and I discussed this before we got on, about not relying on the healthcare system or a doctor or blah, 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 to be responsible for your health, because there's no way, there's no person, there's no institution. You are the only one who lives with you every day. You have to be the one in charge. But I want to go back to what I'm going to call the lie, Because when people would come to me and they'd be on medication and they'd want to see if they'd make progress, I would tell them to, again, I didn't necessarily feel like I needed to check in with the doctor because I didn't say, don't take your medication. I just said, can you wait to take your medication? If you're taking your medication every morning, can you take your blood pressure before you take the next pill? So that way we can have a more realistic view, because if the medication is going to bring you to a normal rate, we don't know if this is helping. If the exercise, I mean, of course it probably is in theory, but we can't measure it because the medication is masking the numbers that it would be real without it. So for the people that are doing these tests, I mean, do the doctors how?
Yeah.
I look at it as it's not the truth. It's the medication doing it. It's not you. It's not your real number.
Correct. Well, it's especially for let's say your clients or people who are exercising, it's probably a combination of both, but you don't know which component is making a more significant difference. Is it medications? Is it their exercise? And the truth is that they're on medications. If you stop the medications, certainly their blood pressure will be higher. It's virtually guaranteed. We don't know how much higher generally, but it's going to be higher. So I would say, few instances in my patients who have really gone through a transformational sort of change in their, exercise and diet and weight loss. And in those instances, we will have to pull off medications. We'll have to stop, reduce. And this is the best time to be a physician. Like, this is where the patient is really taking charge and they're really owning it. And I love doing that. I love peeling off medications. They're saying, well, okay, let's drop that dose and let's drop that dose and let's stop this one and let's stop that one. That's great. But the only way is if you have a trend in your blood pressure. Let's just use hypertension. If you have a trend in your blood pressure and you see that on medications, that blood pressure is marching downward, and then they'll say, well, doc, what do we do? I mean, my blood pressure now is 105/60. I'll say, okay, great. Now I can stop this one medication, but continue the others. Let's stop one at a time, see where you equilibrate to, and keep going with your exercise routine. And let's see if we can get another one off, in a couple of weeks or a couple of months or so. So we start that process. It is a trial and error, and it's a back and forth, and it's sort of a partnership with the person. But in those great situations, it's the people themselves, it's the patients that are taking charge, because I only see them for 15, 20 minutes once every 6 months or so. I don't see them every day, and I don't see them every week, and they're not communicating with me all the time. But if I know that they're an active part of their healthcare, I can trust them to say, okay, JJ, you're going to send me readings in 2 months and give me an update, give me your weight, give me your exercise routine, and give me your blood pressure medicine, and let's see if we can stop another medicine. That's the best case scenario.
Yeah, I would hope so. And I would hope that a lot of people would be aiming for that. But I do know there's a culture around, no, I'm fine. Look, I'm on meds. so I don't have to do anything. I'm on the meds. The meds do it for me. It's like, okay, well, that's not who I think I attract. So we don't have to go down that path. But some people listening and that are listening are married to those people, or they're their parents, or they're their best friends, or their bosses or something. So I just want to be clear that the different kinds of people out there, both listening and existing in the world, are the ones that will not change their habits and behaviors because they do want the medical system or the medication to do it for them. And then there's the rest of you who are listening who actually want to do something. So let's continue with this idea of monitoring. Now, does Aktiia, is that what it's a monitoring system?
Yeah, at its core technology, it is an optical sensor-based blood pressure system. So it will, instead of having to put a cuff on, sit in a very prescribed position, don't talk, don't eat, don't drink, have an empty bladder, don't have any kids around, breathe for 5 minutes. And that's how you're supposed to take a blood pressure measurement, which is not, real world for most of us. You just put it on your wrist and you go on about your day, and you get about 20 to 30 readings every day, no matter what, and about 200 a week, about 800 a month. And so you can really start to see that trend, that real picture of, instead of a snapshot, the real movie, so to speak, of your blood pressure. And so it's very similar to like a continuous glucose monitor for diabetes, as you really start to see much more granular details about your blood pressure patterns, and not just a specific point in time static measurement, but this dynamic pattern that really is representative of our blood pressure. So that's what really the core technology and transformation.
And this is a personal device.
Personal device. It's over the counter. You can, we do work with health systems as well, but largely people buy this themselves and they put it on, they set it up. It all runs through your phone. It gives you everything on your phone. And then if there's a health system that is participating with our software, your data is automatically shared with your physician without you having to do anything. And so that's really where we deliver the data both back to the person and to their healthcare team.
Awesome. And is it something, so obviously it would be recommended for everybody, but it was more specifically anyone that's had any indication of any kind of heart stuff, who's really trying to reverse that situation, or anyone who has it running in their family, who is trying to avoid that through lifestyle choices but wants to sort of be on top of it, or anyone, of course, who's just super preventative that wants to know and to be curious.
All of those things. And in fact, when we look at our real world users, and we're approved throughout the EU, we have about 35,000 so far. And when we look at them, it's actually not just a sort of, super proactive, younger sort of generation. I'd say the majority of them are over the age of 55. And so there's a lot of people, I think it spans that entire spectrum that you just mentioned, from the sort of proactive prevention, really data-driven sort of generally younger population, to I've had some event, or I'm worried that I might have an event and I really want to, track my blood pressure because it is a primary input into almost all cardiovascular diseases and many other diseases as well. So it's still sort of this big, broad spectrum, and it's useful for all of that.
And can people buy it independently, or do they have to buy it through a medical system?
They do not have to buy it. So all blood pressure devices are over the counter generally, right? Just like all cuffs are. And so in the markets where we're available, they can purchase it directly from our website. And we're obviously exploring other channels of distribution as well. But you can purchase it through our website. There are some healthcare organizations that we are working with throughout Europe where they are the ones delivering the devices to their patient groups, and that's great too. But both are possible.
Awesome. Well, I'm glad to share this with everybody because, again, I do have a population that is proactive in many ways. Maybe not everybody is proactive about the same things, but at least having the technology and the tools to change our lives in meaningful ways that we can measure and that makes sense. This definitely is one of them. So most people wouldn't think, as we stated at the beginning, the high blood pressure is definitely not a red flag for people. They're like, oh, I have high blood pressure. It's so common that it's almost like you have a wart or you have I don't know, like it's so common and we ignore it. Yet it, like you said, it's the underlying start of bigger things in the future. And if we don't take it seriously now, we can't go, what happened? You kind of ignored the first red flag and the first, that your body was trying to give to you. And that's what I always say about cancer too. Cancer is the wake up call. Cancer is the point in time where the body, and the heart attack too, is the time the body says, look, you haven't been listening and I can't say it any louder. So I'm going to stop you now. And if you don't listen, you won't like where this takes us.
Yes.
So blood pressure is the first, maybe body telling you to do something. So hopefully you guys will all check out Aktiia and get your devices and really rest more easily knowing that you can track this and that you're ahead of it versus some, oh my God, heart attack all of a sudden or some big issue, which is going to cost more later when that happens. You either pay now or you pay later. And why not pay now to get this information and to know where you're going with it, be responsible with it. And then, just do the best that you can and enjoy life, but not to stress out about it. Yes. It's right. Like especially because the cuffs are like, you just listed all those things. I'm like, really? All those, you have to breathe for 5 minutes. I never did that with anybody. And I've never done that in a doctor's office when I've had my blood pressure checked. In fact, I usually go in and I've just sort of run in and the whole thing. And, I'm still 105 over 70, but, or 65, but, but needless to say, the protocol of all the different conditions that need to be met to get an accurate reading are not being done. So I love that this device makes it easier and that your passion and commitment is to prevention because that's where I think it's at, because we can make a lot more difference if we catch it before it happens.
Absolutely.
Awesome. Well, anything else, Dr. J, you'd like to share with the audience about yourself or this work or this device?
No, I think, I mean, we've covered a lot of it. I think, for information purposes, I would just say the website is the best place. We post everything there, and you can get on the mailing list, and we'll push out updates. We hope to bring it to the US soon. We're actively engaged with the regulatory bodies. So hopefully it'll be available in the US, but we'll keep pushing forward. And no, I'd just like to thank you for being on your show, and I really appreciated your time.